Lisa Follis is going to present on the Verve project.
Good morning, everybody. Today I'd like to tell you about the Verve network of healthy living centres, which is managed by our Promoting Wellbeing team within the Southern Trust and funded by the Department for Social Development. To set the scene for our work in Craigavon neighbourhood renewal area, I will just give you a little background to neighbourhood renewal. Neighbourhood renewal exists in response to People in Place. This was a strategy for neighbourhood renewal launched in 2003, which led to 36 deprived areas across Northern Ireland being chosen to receive support. The aim of People in Place was to improve the social conditions for the people who live in the most deprived neighbourhoods through better coordinated public services and the creation of safer environments. Our approach involved tackling health inequalities in the most deprived wards in Northern Ireland, and here in the Craigavon area this has included North West Portadown, Brownlow and parts of Lurgan. Through local neighbourhood renewal action plans, the social determinants of health, as seen on the Dahlgren and Whitehead model on our slide, have been addressed. The action plans to local social and economic issues and local living and working conditions with the aim of increasing opportunities and improving the physical environment for residents. They have also aimed to improve community networks and to work with individuals to address lifestyle factors and behaviours. The Southern Trust have worked locally to address the objectives of social renewal over the past 3.5 years by identifying and establishing a network of healthy living centres in the Craigavon neighbourhood renewal area. Collectively, the healthy living centres are known as the Verve network of healthy living centres. Individually, they are delivering healthy lifestyle programmes within their neighbourhood, enabling the Southern Trust to meet its strategic objectives in areas of deprivation and with those that are hardest to reach. Our healthy living centres include Community Intercultural Programme, Drumcree Community Trust, Drumellin Community Association, Edgarstown Residents Association, Fitzone Foundation, Shankill Lurgan Community Projects, probably known to us all as Mount Zion House, Tagnevin Community Development Association. And from all of these centres, there's a very vibrant programme of healthy lifestyle. The Verve Healthy Lifestyle Programme has implemented a grassroots approach, and on this slide I will use some photos to tell you the story of how we've developed and established a successful programme. Initially, local people were identified through the network of healthy living centres to work in partnership with us in the Promoting Wellbeing team to tackle health inequalities. To build their capacity and skill and to deliver evidence-based health messages and to enable behaviour change in those individuals and groups they work with, these individuals took part in training through the Promoting Wellbeing team courses and through City and Guilds. They were the first group of people in Northern Ireland to complete the City and Guilds Health Trainer Certificate, and here they are at their celebration ceremony being photographed with Mr Edwin Poots, Health Secretary at the time, who presented their award. I will now play you a short clip of one of the health trainers telling us about her experience in the role.
I'm Christina and I'm the health trainer here at Drumellin Verve Centre. Before I became a health trainer, I was a stay-at-home mum. I did voluntary work with Drumellin Committee and Home Start. Then I had the opportunity to train as a health trainer. The most rewarding thing about the health trainer role is helping people. It's really nice to be able to give back. Here at Drumellin, our Verve programme, we offer a variety of classes and courses. We have things like the Luncheon Club, we have cooking programmes, yoga classes, movement and dance, colour breathing, walking group, something to suit everybody's needs.
The next photo shows those who work on the Verve Healthy Lifestyle Programme coming together to plan their programmes. A partnership approach has been one of the strengths of the Verve programme, and because of this, the community and voluntary organisations under the guidance of the Trust are working towards formalising their partnership approach as an umbrella body under the name of the Verve Network. Currently, the network comes together bi-monthly to steer the project from a community perspective and to develop a strategy for sustainability post-neighbourhood renewal funding. To communicate with the residents, the Healthy Living Centres promote their programmes quarterly in the Fuse newsletter, which is circulated to 10,000 homes in the area. The Verve Facebook page is also used to update the community on information related to health and wellbeing and the Verve programme. The programme is inclusive of all the community. And here we see a group of older ladies coming together to take part in activities such as craft and chair-based exercise. These type of groups are particularly important for building and sustaining social networks, which are so important for well-being. Our health trainers deliver many types of health programmes to groups, as well as working with individuals on behaviour change on a one-to-one basis. Here we see them training a group of domiciliary care workers in Mount Zion House in emergency life support skills. And here we see a group of men, a group notoriously hard to reach. They're engaged in physical activity through golf, providing the health trainers with a way in to address their health and well-being issues. Through the project, we link with many other organisations in programme delivery. And here you can see the Action Cancer bus at one of our Healthy Living centres. The health trainers can be found in many venues around the community doing outreach work, and here they are at a local primary school delivering sessions on healthy eating. Frequently, the health trainers do pop-up health clinics in local venues such as shopping centres and libraries, where they do brief intervention and mini health checks. And here we have the health trainers at the local Southern Regional College, raising awareness of the Stop Smoking service within the Southern Trust. The health trainers act as a link between the community and voluntary sector and the Trust, referring into services such as smoking cessation, our falls clinics, GPs, and many other relevant services. Signposting is a very important part of their role.
My name's Paul Johnson. I have a long-term medical condition and I'm type 1 diabetic. Through the Verve programme, I have learned challenging your condition, colour breathing, and I've walked around Lurgan Park every week. I found it very beneficial because the first class I took in Mount Zion House, Lisa explained to me about cutting down a wee bit on food, and I've got 3.5 stone off. I'm a lot fitter, I can walk a lot better now, I'm less out of breath, I'm not healthier, I'm not more positive.
As a result of a collaborative approach to health and well-being by the Southern Trust and the community and voluntary organisations involved, the project outcomes are increased individual and community capacity to address health and well-being issues throughout the Craigavon neighbourhood renewal area, focusing on prevention and early intervention. We've provided a new evidence-based grassroots programme in the Craigavon area through the Health Trainer programme. We've increased opportunity for referral pathways between the Southern Trust and the community and vice versa. And we've improved the health literacy and physical, mental and emotional well-being of programme participants. With regard to sustainability, the Verve network are being proactive to ensure their programme does not come to an end when neighbourhood renewal funding ceases. To this end, the network are strategically placed as a member of the Healthy Living Centre Alliance for Northern Ireland, giving the network the ability to link in with health initiatives with a regional remit. We always measure our impact and use pre- and post-line client information using the data collection recording service, which links to a national database used by health trainers. The Verve partners are currently working together to secure funding for health and wellbeing programmes from external funders, and avenues to be explored include funders such as Big Lottery and Public Health Agency. We're also exploring income-generating business models for sustainability, which include companies of community interest and social enterprise models. And so, thank you very much for listening to me today. If anybody does want to find out any more about the project, you can get our referral forms and a short DVD and our newsletters, all on the Neighbourhood Renewal section of the Trust website under Healthy Living. Thank you.